going to look at the coagulation pathway abnormalities. And as we start with some questions, the first one is, in case of the prolonged PT, what are the inherited causes? And the second question is, in case of the prolonged APTT, what are the acquired causes? So in this video, we'll find the answers to these questions and learn in detail. So first, we begin with the prolonged PT. So we begin with the prolonged PT. So what happens in the prolonged PT? So there is it evaluates the extrinsic. So it evaluates the extrinsic pathway factors. And then if you see the normal PT, this comes up to 12 to 16 seconds. And then we have something known as the inherited causes. So what is meant by the inherited cause? The inherited cause, it includes a factor 7. So this factor 7 deficiency. Then we look at the acquired causes. So what does this acquired causes include? So this includes the mild. There's mild vitamin K deficiency. There's mild vitamin K deficiency. And there is also presence of the liver disease. There is presence of the liver disease, as well as there is the warfarin, that is the defective. So it can be the acquired causes. Next we move on to the prolonged APTT. So then we move on to something known as the prolonged APTT. So what is the prolonged APTT? So this includes, or it evaluates. What does it evaluate? It evaluates the intrinsic pathway. It evaluates the intrinsic pathway and pathway factors. So it evaluates the intrinsic pathway factors. And what about the normal APTT? So we need to know what is the normal APTT. So the normal APTT is nothing but about 26 to 34. So 26 to 34 seconds. So what is this inherited causes of this illness? So there is inherited causes. So if we look at the inherited causes, this includes the factor 8. So it includes the factor 8, it includes the factor 9, and it includes the factor 11 deficiency. So these are the factors which are involved. Then we also have the factor 12. We have the factor 12 and the pre-kallikrein or the HMW, the HMW kinogen, the deficiency. Then there is also the presence of the von Willebrand's disease, that is VWD. Next we are looking at the acquired causes. So what are the acquired causes? So this acquired causes, it includes the heparin. Then it also includes the lupus anticoagulant. So the heparin, lupus anticoagulant, as well as the von Willebrand's disease. Lastly, we move on to the other heading, that is a prolonged. There's prolonged PT. There's prolonged PT along with the prolonged APTT. There's prolonged PT along with the prolonged APTT. So what does this do? It evaluates. So it evaluates the common pathway factors. So it evaluates the common pathway factors. And now we are looking at the inherited causes. So what are the inherited causes of this? So the inherited causes is nothing but there is a prothrombin. There is prothrombin. There is a prothrombin 2. Next there is fibrinogen 1, as well as the factors. There are factors 5 and the factor 10 deficiency. Then we move on to the acquired causes of this. So when you look at the acquired causes, it includes the DIC, that's a disseminated intravascular coagulation. Then there's also the severe liver disease. Next, when we see, there's also the severe vitamin K. There's vitamin K deficiency as well. And then there is a direct thrombin. Inhibitor. So direct thrombin inhibitor. So this includes the argatroban. It includes the argatroban as well as the dabigatran. Next we move on to the direct factor XA, direct factor 10A inhibitors. So what does this include? This includes the rivaroxaban. Then there is also the apixaban and the edoxaban. Next, there is also the fondaparinux. Now we'll move on to answering our questions. So the first question we asked was, what is the inherited cause in case of the prolonged PT? So we are looking at the prolonged PT. So in case of the prolonged PT, what is the inherited causes? Inherited cause of this prolonged PT. So the inherited cause of this prolonged PT is nothing but the factor 7. The factor 7 deficiency. Next we move on to the acquired causes. The acquired causes of the prolonged ABTT. So prolonged ABTT, what are the acquired causes? So this is nothing but it includes the heparin. Next, it also includes the lupus anticoagulant. And the acquired. There is acquired von Willebrand's disease. So this was about the defects of the coagulation pathways, and to learn more daily you can subscribe.